right, next up, we're pleased to have Dr. Paul Song here with us to share his views on how we can advance the fight for healthcare for all. Dr. Paul Song is a radiation oncologist, co-chair of the Campaign for a Healthy California, and a board member of Physicians for a National Health Program California, People for the American Way, and Asia Pacific American Institute for Congressional Studies. So let's put our hands together for Dr. Song.
Thank you. You know what, I'm going to talk without this. First of all, just Representative Chu just came into the room, and I hope you'll, one, really congratulate her and also show your support. She signed on to the Medicare-for-All caucus, which she's going to talk about. And also, for those of you that don't know much of her record, she has been a staunch progressive, starting from her time here in the California legislature to now being in Congress. And then her other half, Mike Eng, who's running for state senate, I think really deserves all of our support as well, because he has been a staunch progressive all of his years in the assembly before, and I think will be a great state senator as well. So I hope everyone will really rally to support them. I just want to share a little bit about what's happening here in the state of California, but also nationally. I am co-chair of the Campaign for Healthy California, which is a group of everything from community activists to labor organizations to professional organizations that have all come together to say that we need to have a better healthcare system here in the state of California and nationally. The big thing is this, that as much as the Affordable Care Act did do a lot of positive things, one example is that, you know, prior to the Affordable Care Act, there would have been a lifetime cap on what you would have, your insurance coverage would have covered, and anything beyond that people would have been out of pocket. And as an oncologist, I saw a lot of patients who had been fighting cancer for many, many years who were no longer able to afford payment because their insurance companies were no longer paying for anything because they had used up all their expenses. So the Affordable Care Act did do a lot of good things, but here's the reality of it. There were 3,300 registered healthcare lobbyists for the 535 members of Congress. They spent more than $1.2 million a day. In total, more was spent lobbying for the Affordable Care Act than was spent on the Bush-Kerry election. And that's why there was no insurance rate regulation, no pharmaceutical drug pricing control, and that's why 30 million people are still uninsured here in the United States, of which we have close to 3 million here in California. What's also more shocking is we have about 250,000 kids here in the state of California who are uninsured. And while those are just the people that are uninsured, the number of people who are underinsured is even greater, meaning that you have coverage, but it isn't worth the paper that it's printed on. Because co-pays and deductibles are so high, many people will delay seeking care. 1 out of 3 people delay seeking care because they can't afford their co-pays and deductibles. If you have a yearly $6,000 cap and you feel, let's say, a lump in your breast, and you have to pay for everything before that first $6,000 is used up, most of the time you're not even going to go get the mammogram, you're not going to go get the biopsy, you're not going to go see the doctor. So having coverage doesn't necessarily mean you have access to care, and that's one of the things that we need to change in our society. The other thing is pharmaceutical prices are so high that 1 out of 10 seniors has failed to fill a prescription, and last year 45 million Americans reported not filling a prescription because they couldn't afford it. So despite all the great things that you hear about our healthcare system, it is not accessible, and that's one of the things that a Medicare-for-All system would change. Now, you've heard a lot of people try to say that it's too expensive, we can't afford it. You had a Koch brothers study that was recently funded by George Mason University. They funded it, done at George Mason University, and what they found was it was going to cost $32 trillion over the next 10 years. But what they failed to mention was in the same study that if you didn't do anything, it would cost $34 trillion. So meaning you could insure everyone who had current Medicare, you would increase their benefits, you'd do away with their co-pays and deductibles, insure every single person, including all of our undocumented brothers and sisters, bring everyone's healthcare costs down, and it would actually cost $2 trillion less than if we do nothing. So that gets to the question, why aren't we doing anything? And I got into a lot of trouble a couple of years ago during a rally where I said the biggest obstacle to Medicare for All was we had too many members of our own Congress who were beholden to the pharmaceutical industry and the private insurance industry. And I still believe that now more than ever. And just last week, a study came out in the a Reuters poll that found 70% of all Americans now favor Medicare for all, 85% Democrats, and even 51% of Republicans. So the only thing that's really standing in the way is political will. But here's what's going to happen. Through us no longer being silent, and especially among all communities, but we can do our part among being Asian Americans, we're starting to see a sea shift. Here in California, we didn't get our single-payer bill passed, and people say, well, that was a waste of time. I don't think so, because we rallied people in every congressional district, every state assembly district, every senate district, and as a result, who was the very first person to co-sponsor Senator Sanders' Medicare for All bill? It was Kamala Harris. Why did she do that? Because she couldn't ignore the overwhelming support that was happening here for Medicare for All in her own state, and rightfully so, she signed on to that. And that's how we change this. This is how we get people elected. So in New York, as many of you know, Joseph Crowley, who was a bastion of a political sort of powerhouse in the Bronx, Queens area, he lost to Alexandria Ocasio-Cortez, who ran unabashedly as a Medicare for All candidate. So I think it's time that one, we support people like Representative Chu, who have been fully embraced and supportive of Medicare for All, but then we also start to elect people who are really, or get people out of office who no longer are really voting for our best interests. Finally, I'll just say this about California. There was a lot of criticism regarding the bill, that it didn't have a full funding mechanism in, it didn't have ways to deal with the federal waiver and Prop 98 and all those things. Those are really legitimate questions and issues. But I think what was really lacking was not specifics there, was the political will. Because if we had a state assembly and a governor that really wanted to bring this about, they could put the brightest minds in the room and solve this. Yep. But as long as they're beholden, again, to the California Medical Association and other organizations, Kaiser and such, that want to preserve the status quo, this is what we're going to get. So please keep up your fighting. Just like the marriage equality thing, from 2008, in a short period of time, not only did we overturn Prop 8 here in the state of California, we had full marriage equality, not only in the state of California, but federally. We can do the same thing with Medicare for All. That's the type of sea change that's happening right now. So I encourage each of you to really get involved, to contact your representatives, to demand that they sign up for this Medicare for All caucus if they're not part of it. They co-sponsor HR 676, which is the congressional bill. And then everyone here in the state of California, that you demand your state assembly and Senate to really sponsor any future Medicare for All single-payer legislation here in the state of California. Thank you very much.
Thank you, Dr. Song.